Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual for over 30 years now. You're listening to Ask the Doctor, and I'm Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins. And my co-host and cohort in crime is Dr. Susan Summerton, also of the Lange Eye Institute and the Villages, Florida, and Fortifeye Vitamins. And we're both here to answer any and all questions regarding your vision, eye care, or a nutritionally related topic. So we're not only both board-certified optometric physicians, with both certified nutritional specialists, and Dr. Summerton has taken it to the next level. She's got more initials after her name than anybody. So I'll let her expand on that in just a second. But remember, this is a live call-in show dedicated to you, the listener. This is a live show today. It is not a tape. Last week was a tape. My daughter got married. So, every now and then you cannot come to the show and do a live show. So it's once in a blue moon. She had a great wedding. And I had to be there, all right? Otherwise, some people would have been ticked off. So anyway, phone lines are open, 1-877-969-8600, 1-877-969-8600. Today is June the 1st, 2019. Just teasing. June the 1st, 2024. Wow. Can you believe how fast time flies? I want to welcome a new station. We're expanding this network. I mean, we're coast to coast and live video streaming all over the world. So it's actually good morning, good afternoon, and good evening, just depending on where you're at. But we're welcoming a mega station in Memphis, Tennessee. It's WUMY. It's AM and FM station. That's 8:30 AM and 105.5 FM in Memphis, Tennessee. I had some good times on Beale Street back in the day. In Memphis, Tennessee. That was in the 80s or the 90s. Yeah, it was the 80s. So anyway, Memphis callers, and certainly we're also on some new stations in Philadelphia, Chattanooga, Tennessee, Indiana, Ohio, Kentucky, Alexandria, and Shreveport, Louisiana. So if you've got a good jambalaya recipe or maybe a roast beef po' boy recipe, call us. All right, one more time. Phone lines are open, 1-877-969-8600. Good morning, Dr. Summerton. Thanks for being a co-host today, and expand on some of your credentials.
Well, good morning, Dr. Lange, and congratulations to your daughter, and also welcome to Memphis. And yeah, my credentials mostly involve obviously being an eye doctor, and then involving my passion for nutrition as a certified nutrition specialist. And this is something I got into after I was already a doctor, because we just don't learn that much in college and grad school about nutrition. It's always been my passion. So I went on and furthered my education, a lot of it at the University of Miami School of Integrative Medicine, and expanded that knowledge. And I just continually read about it. I've been a professor of nutrition, mostly because I was reading all the studies, doing all the research, and wanted to share it with people and have students learn about it too.
And you're a diplomat and a fellow, aren't you?
I am a fellow and a diplomat, yes.
And that's, I don't want to brag for you because you don't brag enough, but you are the only optometric physician that's a certified nutritional specialist in the state of Florida, and a diplomat and a fellowship trained in nutrition.
As far as I know, but I would love others to join me with all those so that they also can share the knowledge and help people on their health journey.
And just think, you can actually see Dr. Susan Summerton at the Lange Eye Institute in the Villages, Florida. I'm going to give you the phone number twice. It's 352-753-4014. Lange Eye Institute in the Villages, Florida is 352-753-4014. Also, you can learn more at drmichaellange.com. That's simply DR, so drmichaellange.com, and that'll link you up to a variety of other websites that we have. Also, if you're in tune with the nutritional products that we've developed, we've done all the research and development for the Fortifeye vitamins. You can go to fortifeye.com. That's www.fortifeye.com. That's FORTIFEYE, fortifeye.com. And you'll see at the top of the heading on the page on Fortifeye, there's a BOGO right now. That's buy one, get one free for our advanced retina formula. So those of you that have macular degeneration, or those of you who just want to take something that's a preventative approach, remember Fortifeye Advanced Retina Formula we developed a few years back based on the age-related eye disease study. We modified it a little bit. We cut the zinc from 80 milligrams of zinc oxide to 30 milligrams of zinc monomethylthione. We threw the copper away. We added natural vitamin E instead of synthetic vitamin E, no dyes, put it in a gel cap, and we added resveratrol and astaxanthin to it. So it's a cut above, I like to think, of the typical vitamins out there based on the age-related eye disease study. So people can take that preventatively, or you can take it if you truly have macular degeneration. You know, doctors in tune with macular degeneration and retina specialists all over the world recommend the AREDS 2 formula, but we've, like I said, enhanced it. So remember, that's a BOGO, buy one, get one free. So automatically when you buy one, I think they automatically give you two. If you buy two, you automatically get four. So come to the Lange Eye Institute, the Fortifeye Nutrition Center in Clearwater, or the Lange Nutrition Center in Ocala, and you can get that deal. But we're still running. You got to remember this now. We're still running the 40% off deal. And the 40% off deal is on our chocolate protein, the Fortifeye Super Protein, which is dark fudge chocolate. It's New Zealand grass-fed, non-denatured whey protein, and our organic blue-green superfood, which has been a huge hit. So those are still 40% off if you use SUMMER40. That's the code. Write that down, SUMMER40. Put it in the promo code section at fortifeye.com or one of the other places that you can purchase it at. You're going to get 40% off the chocolate protein, the superfood, and also the advanced retina formula, but you can't double dip and get 50% and 40%. That'd be 90%. That's not allowed. So remember, take advantage of that. All right, let me give you the phone lines one more time if you'd like to call and ask us a question. Remember, call earlier in the show. A lot of times you get toward the end of the show and you call. Remember, this used to be a 2-hour show. It's only a 1-hour show now. That's why a lot of you call later, because we had 2 hours to talk. But we run a tape the next hour because I get worn out talking. So phone lines are 1-877-969-8600, 1-877-969-8600. So since we're both eye doctors here in the studio, I got a question. Is an eye exam, Dr. Summerton, only for looking for eye disease? Do we only want to look and find glaucoma and cataracts and macular degeneration, find their prescription for glasses and contacts, and look at the peripheral retina for holes, tears, and detachments? But is an eye exam also a good form of prevention?
Absolutely, especially when we're allowed to look inside the back of the eye at the retina through the pupil with either dilation or one of our favorites, optomap, being able to see that. But we can see the nerve that goes from the eye to the brain. That's a cranial nerve. We can see all the blood vessels that come from the brain. So they're actually brain blood vessels coming into the back of the retina. The retina is an extension of the brain. So we can see like little lipofuscin molecules. Hopefully we don't, because we know that is a sign of Alzheimer's. We can see bleeding, which could be hypertension, could be diabetes. We can see cholesterol deposits forming. So there's many things. We're looking for anything wrong with the eyes, but to give us a clue of what's going on with the rest of the body.
Right. And once again, the optomap is really something that we love. And there's some other products that are similar to the optomap, but the optomap enables the doctor to look at the entire back of the retina in front of him on a screen instead of shining a bright light in your eye. And it's hard to miss things with the optomap. It really is. Some doctors can miss with the indirect ophthalmoscopy. I don't care how good you are. You can miss certain pathological changes in the eye. But with the optomap, it's very difficult to miss anything. Remember, the optomap also goes under the retina into the choroid and looks at the choroidal capillaries. These are tiny, tiny blood vessels that oftentimes we can see plaque building up and occlusions and bleeds and things under the retina that could be a telltale sign of, a systemic disease that could be potentially life-threatening. So an eye exam may not only be vision-saving, ultimately it could be life-saving. You know, a word that's really hard to say, Dr. Summerton, is the Alzheimer's.
It is
Should I
hard to say.
I mean, I call it Alzheimer's, all right? Old timers, Alzheimer's. But how do you really pronounce it?
Alzheimer's?
It's hard to say.
Alzheimer's?
Alzheimer's. Let's see, I can't speak. Let's try to say that 3 times really fast. How about rubber baby buggy bumpers 3 times really fast? I can do that. Rubber baby buggy bumpers, rubber baby buggy bumpers, rubber baby buggy bumpers. And I bet you anybody listening can't do that. If you can, call me and do it 3 times really fast. And you know what? I might give you a prize.
40% off.
40% off. That's right. Phone lines are open. 1-877-969-8600. That's 1-877-969-8600. So fitness for all ages. You know, Dr. Summerton and I, we try to stay fit. We try to practice what we preach. And exercise is important for everybody at any age. When you're in, grammar school, high school, my mom's 96. I get her on the vibration plate. I get her out walking. I get her sitting in the sun, and she's going strong. So exercise is crucial for everybody at any age. So exercise goes hand in hand with weight management. All right. So if you exercise more, obviously you're not as fat as you could be. And so those are 2 things that go hand in hand for overall improving wellness. Now, remember, we make your overall body healthier, we're making your eyes healthier, and vice versa. So weight management combined with exercise, not only we're going to build muscle, strength, and endurance, we're going to slow down sarcopenia, which a lot of you listening right now are over 60 and you're getting weaker every day, flabbier every day. That's called sarcopenia. We can slow it down through exercise, proper diet, the proper supplements. Fortifeye Fit Pro. I'm going to plug that right now. Go to the website, look at Fortifeye Fit Pro. We worked on that for years and years and years. We came up with Fortifeye Fit about 6-7 years ago. Big hit. We actually enhanced it. We call it Fortifeye Fit Pro. Not only for the elderly to stop sarcopenia, we've got world-class professional athletes, world champion athletes taking it, and the weekend warrior, and my 96-year-old mom. So Google Fortifeye Fit Pro or go to fortifeye.com. Look at the science. Look at why we put all of those nutrients together in the Fortifeye Fit Pro. Remember, it's all about helping you to build muscle safely, strength and endurance at any age. Remember, exercise, weight management is good for all eye diseases. Numerous studies indicate that if you're overweight and out of shape, you're going to accelerate your macular degeneration, cataracts, dry eye, and glaucoma. So get in shape. And I got to tell you, today is the first day of my 30-day vacation. Not 1 week vacation, 30-day vacation. I am going to come 3 Thursdays to see some of you that will raise a little bit of a difficult time in the office if I'm not there. So I'm going to be there for 3 Thursdays during the month. But I'm going to find myself. I'm going to go on a walkabout during the next 30 days. So we're going to talk more about exercise. We're going to talk about something that's kind of exciting, that exercise can increase, not only helping your muscles, strength, and endurance, but something called brain-derived neurotrophic factor, or BDNF. We'll talk about other supplements can help that. And Dr. Summerton is more of an expert than I am. We're going to talk about that in a minute, but we've got a few people on hold. We're going to go to the first caller. Let's see. I think it's Ellis in New Mexico. Ellis, thanks for holding. Good morning.
Well, thank you. I'm a World War II veteran. I'm 98 years old.
Wow.
Since 2012, I have had macular degeneration. I had injections for several years, haven't had any for the last couple of years, but I have scar tissue, which makes me legally blind. I can see light, I can see shapes, I just cannot focus. Is there anything that can be done about it?
Wow. Well, thank you for your service. And wow, 2 more years, you're going to be 100. You need to come fly down here and be a guest on our show. So, at this stage of the ball game, all right, if you're that macular degeneration, it sounds like you had the wet form of macular degeneration, and it's probably dried out because you've had the injections. You have probably a large scar in the center of your macula, okay? Now, you do have peripheral vision. You have side vision still, right, Ellis?
Yes, to some extent.
Right.
Mhm.
So you're probably never going to lose that side vision. So you never go blind from macular degeneration. I repeat, you never go totally blind from macular degeneration. You can become vision impaired, okay, where you can't see the big E, but it doesn't affect your peripheral vision. Things like glaucoma, retinitis pigmentosa, ischemic optic neuropathy, things like that can affect your peripheral vision. And then some people do develop both and go totally blind. But your quality of life definitely gets impacted negatively with macular degeneration. I would recommend finding a low vision specialist that's in your area that could help you with, some low vision devices that can enable you to maintain your independence or regain some of your independence, allowing you to read what you want, be able to spot things in the difference. So there's a lot of low vision technology now that's very simple to use, that works quite well, that people aren't aware of, and many doctors are not aware of it. So you could get somebody just to Google low vision specialist on the internet for you, and then find out where it is, and you can go out and visit with them. And some of these low vision specialists can even come to the house. But I would also recommend, Ellis, you're 98, and who knows, you could live another 15 years, okay? And so we don't want to give up. And so proper nutrition is still crucial. I recommend eating a lot of dark green leafy vegetables, as long as you're not on Coumadin, all right? Orange bell peppers, wild Alaskan salmon, eggs, and blueberries. And then the vitamin I was just talking about, the advanced retina formula, is not going to treat this. It's not going to cure this, but it's going to give you some of the nutrients that clinical studies have shown to help support the retina. You obviously still have some usable retina because you still can see. So that's probably something I would recommend, something based on the AREDS 2 study that's been modified, like our Fortifeye Advanced Retina formula. So proper diet, proper supplements, wear your sunglasses when you're in the sun, eat the foods we talked about in a positive mindset. And Dr. Summerton's an expert in this arena too, and I'm going to let her chime in on her ideas.
Yeah, Alice, nice for calling. I do agree with Dr. Lange on all those things. And we know how difficult it is when you lose that central vision and you can't recognize faces looking straight ahead. But like he said, we do want to encourage that side vision. And those low vision therapy can help activate that more. It's sort of a relearning how to see vision and allow you to walk around and not bump into things and be able to still enjoy time with your family and still be mobile. We want to keep you away from being sedentary, because we know with sedentary lifestyle, everything drops down. So like you said, the low vision, still the good diet, even the muscles of your whole entire body, the muscles of your eyes, keep all that working well.
Well, thank you. I do have an appointment with a low vision doctor at the VA on the 6th of this month. And I thank you very much for listening to me this morning. I have still been able to volunteer at the VA hospital for 6 hours, 2 days a week, because I can still see to get around. Like you say, I can see shapes. I just can't focus.
Right. Well, that's outstanding. Keep it up. And please call us back after the VA appointment, maybe next week or the next week, and let us know how that low vision evaluation went. Okay.
Well, thank you.
All right. You take care. All right. We got listeners of all ages. All right. You're listening to Ask the Doctors, Dr. Michael Lange and Dr. Susan Summerton, both of Fortifeye Vitamins and the Lange Eye Institute. Got a question? Give us a call at 1-877-969-8600. The consultation is free, but it never replaces a medical evaluation or an eye examination. This is for educational purposes only. That way, if my attorneys are listening, they're very happy. I just made that little disclaimer. All right, we're going back to the phones. We got a few people on hold. I think I'm actually going to take Irene in New Mexico first, or Albuquerque, yeah, and then Steve comes second. Irene, thanks for holding. Good morning.
Good morning, Dr. Lange. I've been listening to you for a couple of months now, and I am just really impressed with you and your cohort. I have a question. I've been diagnosed with what is called conjunctival chalasis, and a lot of it, I was told, comes from age and dry eyes. Is there something else I can do for it? Because apparently, as I get older and as the dry eye gets worse, that I might need surgery.
Yes, this is a condition that is more prominent as we mature. Absolutely. And a lot of surgeons want to go in there and do a surgical procedure where they kind of resect it a little bit and tighten it up, kind of like a facelift of your conjunctiva, if you will. But we see this daily, at the Lange Eye Institute. And a lot of times, simply by using a good lubricant and proper nutrition, we can help, because this is going to add to inflammation. Remember, you blink, I don't know, 20,000 to 40,000 times a day. And if your eyes are dry, it's going to increase inflammation on the corneal surface and on the conjunctiva. Then your eyes can get red and inflamed and more inflamed, okay? And it can add to the problem. So I would definitely recommend using a good lubricant that has hyaluronic acid in it, or sodium hyaluron, and that's usually under the other ingredients. And the two that I like the best are Oasis Tears and Optase. And we usually have those on our website at fortifeye.com. And you can find them through lots of doctors' offices. Sometimes that's hard to find over the counter. So remember, Oasis and Optase. And let's say you've tried that. You've tried lubricants and nothing has helped from a lubricating standpoint. There's another drop that we all love, Dr. Summerton, myself, and Dr. Caputi, for dry eye, and it's called Regenerize. And Regenerize comes from the placental fluid, okay? So it's kind of like the fuel for the stem cells, if you will. And it's a little more expensive than the artificial tears because I think it's $75 a bottle. It is also on the Fortifeye website at fortifeye.com. You use that twice a day. But here is where the nutrition is so important. We obviously have to lubricate the eyes, but ultimately we want the body to work to the fullest potential. Remember, God made a pretty good body. As long as we treat it correctly and give it the right fuel, it can do amazing things. And we found that if you use certain specific nutrients, a good reesterified triglyceride form omega-3 like Fortifeye Super Omega, black currant seed oil that's very high in GLA, and then even astaxanthin, which is in our Fortifeye Focus. This is kind of a triple whammy against dry eye, but also inflammation in the entire body. So oftentimes we put people on what we call our advanced dry eye kit. You can look at that on the website, Fortifeye Advanced Dry Eye Kit, and it comes with all three of those. It comes with a bottle of the Super Omega, a bottle of the Fortifeye Focus, and a bottle of the black currant seed oil all together at a discounted price. So that helps act. It gets kind of complicated, but on series 1, 2, and 3 prostaglandins, those are inflammatory markers in your body, and it helps to alleviate these, therefore helping with dry eye that indirectly helps with your conjunctival chalasis, and also helps with people that have joint inflammation and things of this nature. You also find it helps your skin, your hair, and your nails. But this is something that we deal with, Dr. Summerton, all day long, isn't it?
Dry eye especially, but I imagine, Irene, you probably had it for a very long time. And so it's just enabling you to get back to that good tear production, like you said, with those good omega-3s, the black currant seed oil, and the astaxanthin. They're all going to help. Your eyelids are like your little windshield wipers. So you can't be rubbing against a dry surface. That much pressure all day long is going to have consequences. So anything we can do to regenerate that tear film, and Dr. Lange is holding up that dry eye kit there. And it's not something that's going to work day one. That's something that you do have to continually take. Most supplements take a good 8 weeks, if not 12 weeks, to really kick in, because they're not designed to get rid of your symptoms. They're designed to give your body what it needs to fix it on its own. And I don't think you mentioned it, but just simple heat on the glands You want to get a warm compress that's hot enough so you feel the heat, but not too hot where it's uncomfortable. Sit back, relax, let it work the magic for about 10 minutes. And that helps those glands that are in the lids, the top and the bottom, release that good, what we call meibomian glands, that good lipid, that oil into your tear film. So every time you blink, you have that nice lubrication there.
And let me ask you, Irene, what are the symptoms that you're having?
Sometimes I get like a headache, like an eye headache. And then I feel like there's a hair in my eye, on both eyes, and I keep blinking. And then I was told, because I was able to see a picture of the eye, and it had like a cyst. The way I saw it was a yellow spot with a pool of blood in that yellow spot in the eye.
That sounds almost like a pinguecula or a pterygium, blocked meibomian glands. The pool of blood sounds a little funky. Was it just really red, or was it actually blood?
It was a blood, just like an eye drop of blood.
Okay.
But when they took the picture and I saw it, he said it's a cyst, and he said it's yellow. It's like I saw it. It's kind of like when you bump your elbow or your arm, and it turns yellow before it turns blue, or blue before yellow. And inside of that yellow was a spot of blood. He said that is blood, and he said it was a cyst. So I've been using the Optase drops.
And what did the doctor recommend?
He recommended pretty much what Dr. Summer was telling me.
Good.
About hot compress, eye drops. And if it doesn't get any better, at the beginning of our conversation, I heard it might need surgical procedure. And that was one of the things he said I would end up having to have done.
Right.
But I asked, well, would it come back again? And the procedure would probably come back again, even if I had it done.
Yeah, I'd be an advocate of trying to do it as naturally as possible and put surgery off as the last option, unless obviously it gets worse. So this isn't something that's super serious. I mean, it's something that's a little bump in the road. And I think if you do the things that we discussed and then follow the advice of your eye doctor, I think you're going to be fine.
And I think I'll try the azentine and the blackcurrant.
Right.
And those are the three vitamins, the omega-3s. They're on Fortifeye.
Right. You just get the Advanced Dry Eye Therapy kit, and it all comes together at a good discount. So it's called Advanced Dry Eye Therapy. It has all 3 bottles in a little box. And then let us know how you do.
I will. Thank you so much.
Also drink plenty of fluids, all right? And maybe eat a banana and have a handful of sprouted nuts and seeds, because we need the electrolytes too, the potassium, the banana. Or you can drink some coconut water and have a little pink Himalayan sea salt in with the coconut water, because the electrolytes are important as well. Okay?
All right. Thank you, Dr. Lange and Dr. Summers. I really enjoy your program. Bye.
Thank you. And that's Albuquerque, New Mexico. All right. Once again, you're listening to Ask the Doctors. If you got a question, give us a call. 1-877-969-8600. That's 1-877-969-8600. Check out everything we have to offer at fortifeye.com. That's FORTIFEYE, fortifeye.com. It's free shipping all over the country, except when you do the 40% off gig. Then it is a little bit of shipping. It's not very much. All right, let's go to the phones. I think Steve has been waiting patiently. Steve in Clearwater, good morning.
You were talking about tongue twisters like rubber baby buggy bumpers and stuff like that.
3 times real fast.
Yeah, well, what is very interesting about that is, why are those hard to say? If you look at the shortest one that's hard to say is like in basketball, free throw. Try to say that 5 times, free throw, and you can't do it. What's happening there, what they think, and they've actually studied why certain phrases are hard to say repeatedly and others aren't, is because it's the transitional state that occurs, that the linguistic center in the brain does not believe that this same sound can be repeated, and it inhibits it. So you literally can't say it too many times, because the brain believes that this same consonant or vowel combination cannot be repeatedly said. It thinks you're stuttering, and so it stops you. And that's why you can't say it many times. You follow what I'm saying?
I do.
It's a linguistic inhibition. And it's just naturally that happens. It's similar to stuttering, but in a artificial name. And one thing about speech, and why we're here, is one thing that's always amazed me is if you say the sentence, I'm going to take a walk around the block, you have just made 300 to 400 micro muscular movements involving the throat, the larynx, the lips, the tense intensity of the throat, how far the tongue is forward, backward, whether the tongue is curved. It's a tremendously complex thing to say that. And yet Alzheimer's patients can say it.
Mm.
So how do they do something that is that neurologically complex when they can't do other simple things? And there is a theory, and I believe it, that speech actually originates outside of the brain, not inside the brain. And that is a far out idea, but the part of us, which is the soul or the spirit, it can explain reverse speech, which we know exists. And it's a very fascinating thing to find out exactly. I think speech is the most amazing talent we have as human beings. It's uniquely human to a certain extent.
It is.
And I think it's really interesting you brought that up.
So, Steve, it's interesting. If you said this sentence, I'm going to take a walk through the park. I'm going to go to the bar and have a beer. Now, if you were from Boston and if you were from Montgomery, Alabama, it would sound like two different total languages. Now, why is that?
Right. Because accents are based on center. You know the concept of center of gravity of an object?
I know what gravity is, 32 feet per
Okay,
second.
but center of gravity.
Or,
for instance, if you talk, for instance, Scottish people, it's hard to read lips because they hardly say anything and don't move your lips.
Mm-hmm.
Try to not move your lips while you're talking. You'll sound Scottish. Okay, an accent is based on the average of all these factors. So, in other words, if you average a certain tension in the tongue, in German is different than the average tension in the tongue in French. And accents are very interesting. They're very hard to break. If you learn a language after about 10 years old, it's in fact, language is the hardest thing to learn after you get older, a new language. You can learn math, you can learn science, you can learn all kinds of things, but it's language because it's so uniquely human that it makes it very difficult for us to learn new language.
And certain languages are much harder than other. I mean, I can speak a little Spanish and a little French, but I can't speak Chinese. I can't speak Korean. I can't speak Japanese either. So I got to work on that. And maybe I could host the show in Chinese.
Yeah, and the emphasis on the word is something. Here's the reason you can't go just by what it says in a transcript. If I said this sentence different ways, were you there today is completely different than were you there today, which is completely different than were you here today? And that's why a transcript of testimony cannot really tell you what the witness said. You follow my logic?
I do. Steve is the professor of linguistics today.
Yeah, because if I say, were you there today? What am I asking really? Was it you or were you or somebody else? If I ask, were you there today? My question is about the date.
Right.
If I say, were you there today? I'm asking about did this actually happen? And yet I said the exact same words.
You did.
So that's why reading a transcript of testimony is not valid. You have to hear it.
All right, Steve. We're getting loaded up with some calls, big guy. As usual, you always have some very interesting things that make me go, And
I got one thing for you. I want to tell you what the administration wants to do to the medical profession. It's not bad or it's not good. It depends on your interpretation, but how they want to organize the medical world after the election.
All right. We'll talk about that soon then.
Okay. God bless you.
Bye-bye, Steve. All right. You're listening to Ask the Doctors. If you got a question, give us a holler. 1-877-969-8600. That's 1-877-969-8600. 969-8600. We're getting ready to go to the next call in just a second. I just want to just briefly recap. We talked a little bit about dry eye. And, there's really 5 stages of natural approaches to dry eye. We heat the lids. We clean the lids. Okay. We nutrify the glands with something like Fortifeye Advanced Dry Eye Therapy. We lubricate the eyes with something like Oasis Tears or Optase. And there's some other good ones out there. And we hydrate the body with plenty of fluids. I'm drinking something called Wata water. It's a very rare water. It's a polarized water, positive charge, very rare. Has some amazing benefits, hard to find. It's been on back order. Hopefully we have it available again soon. So remember, hydrate, drink half your body weight in ounces of water, and also some electrolytes. So, some sort of electrolyte fluid as well in between your glasses of water. Also, we talked briefly about macular degeneration with that caller, at 98-year-old. We have 3 macular degeneration formulas. Check them out on the website. The one that I like the best is the Next Gen Macular Defense, because it's your multivitamin and eye vitamin. And of course, our advanced retina formula, which is just your eye vitamin. And it's a BOGO right now. Buy one, get one free on the website. And then we're going to talk a little bit about glaucoma in a few minutes and a natural approach for glaucoma. But we're also going to talk about this BDNF factor in a minute. But first, we're going to go to David in Clearwater, my current stomping grounds. David, good morning. Welcome to the program.
Hey, hi, Dr. Lange. Cool. Really like your program. Dr. Lange, I was going to share with you. I was watching this morning a physician, Dr. Michael Nels, Nehls, he's from Germany, and he talked about the importance of vitamin D to improve your immunity against like viral infection, i.e. COVID. And it was interesting, he kind of mentioned that there was a lot of anti-use of vitamin D, and he expounded on during COVID from certain regulators, and agencies and studies, clinical studies. So it's kind of been bashed around a lot, and I wanted to ask your opinion about that. And then there's a second part. He also talked about the use of low-dose lithium salts, right, like 1 to 2 milligrams, to help mitigate or ameliorate like cytokine storms and things. And there is apparently some research in Europe where they did studies where they showed that small amounts of this lithium salt can help people, get much better from COVID. So I wondered, and then the last thing I was just going to say, sorry, doctor, is that fellow Steve that called in just now about speech and all. It's quite, fascinating guy. He sounds really cool. I was going to let you know, my daughter Julia is 28 years old. She has autism, and guess what? She has no speech that she can articulate, right? But she is able to communicate through a letterboard. She types out her thoughts and desires, and she has specialized training in it. And she has speech in her brain, full sentences, she's written a book. She's a lovely, intelligent person, but she's not able to form words, because her brain is damaged in those areas, It's so sad.
Well, it's amazing, though, David, with today's technology, what it's enabling her to do. And think about with AI and the way technology is going in the future, what it's going to enable her to do in the future is going to be even more amazing. So at least, we're not back, 30, 50, 70 years ago. So she's going to have, she'll be able to communicate a lot better than she would have in the past. So
yes, Doctor.
Let's talk about vitamin D first. We do have a vitamin D deficiency in many patients. This is one of the blood tests I used to run on my macular degeneration patients. And most of them were vitamin D deficient, even though we live in Florida. And one reason for that is that, the doctors have scared people into going in the sun because they say you're going to die from cancer if you get too much sun. But I think the studies are pretty prominent that people that get a little bit of sun, not too much, so everything in moderation, their vitamin D levels, their 25 hydroxy score is very high. And we don't want it to be too high. In the sun, you can't OD on the vitamin D. Or vitamin D supplements, you can virtually take too much. That's a fat soluble vitamin. It can build up toxic levels. If you take too much vitamin D, it can actually trigger atrial fibrillation. By the same token, if you have too little vitamin D, it can trigger atrial fibrillation. Same thing with omega-3. If you're omega-3 deficient, more prone to having atrial fibrillation. If you have way too much omega-3, more prone to having atrial fibrillation. By the way, a good omega-3 fish oil, like Fortifeye Super Omega, is a good way to lower that cytokine storm as well, as you were talking about the lithium. So vitamin D, I always recommend having your doctor order a blood test. It's a 25 hydroxy test to check your vitamin D levels. And those levels, we like them above 60. I like them above 70 or even 80, okay? Mine stays about 85. And the only vitamin D I take is in the Fortifeye Complete that I take. So it's about 1,000 units. I'm only taking 1,000 units. I'm fair complected, blondish hair, green eyes, but I do get sun 4 times a week. And so I'm not afraid of the sun. So a little more sun, as long as you're not an albino, have an autoimmune disease like lupus, or you're on a medication that makes you super light sensitive. So most people can get a half hour of sun a day with no problems. Okay. So think about the sunshine. I don't ever recommend more than 2,000 units of vitamin D3 at a time, unless prescribed by your doctor. Okay. Because I see a lot of patients coming in taking 10,000 units of vitamin D3 a day, way too much, and they never had a blood test, so they don't know what they're doing. And a lot of these patients do have atrial fibrillation. So be careful with too much vitamin D. As far as the lithium, I'm certainly not an expert in that area, but I'm going to let Dr. Summerton chime in, because if I don't know it, maybe she does.
Well, thank you for calling. I did want to reiterate the D, we like you taking D3, not D2, for that better absorption there. And getting the blood work tested to make sure what you're taking is enough or not enough. And then also there's other things to look at. If your vitamin D isn't going up, you don't want to keep loading the door higher and higher and higher. You want to look, maybe you're more magnesium deficient, because if you are magnesium deficient, you don't absorb your vitamin D as well. But the best way is to get it that 20 minutes out in the sunshine through the skin. Unfortunately, it won't work if you have sunscreen on. So you just want that short time in the sun to manufacture your own vitamin D. But of course, not all of us are able to do that, depending on where we live. So that's why we like the supplement too. For lithium, lithium's kind of tough. I have heard of it for improving the immune system. Like it improves like the T cells, the CD4 cells, the monocytes. My hesitation for that, I believe the studies were done on healthy people, and lithium can be a problem. People take it with bipolar disorder, mental, to help them with that. But long term, especially, it can cause like goiter. It can lower your thyroid. You definitely want to stay away from lithium if you have any thyroid issues, which a lot of people do these days, especially autoimmune thyroid. So that's my little, especially there's so many other things that can improve our immune system. I don't just think flat out taking lithium without considering the rest of your health is a good idea.
Amen.
Oh, okay. Well, thank you for your assessment, doctors. I understand. It's all about being sure that you're not hurting yourself and getting the more positives than negatives. Thank you for your opinions. It's really nice to talk to you. All the best, doctors.
All right, David.
Thank
Thanks
you.
for the call. You have a great Saturday. All right. You're listening to Ask the Doctors. It's 1-877-969-8600. Talking a little bit about fitness for all ages, getting out there and exercising. Like we said, it can help build muscle strength and endurance. It can help stop sarcopenia. You add our Fortifeye Fit Pro, which is a combination of grass-fed collagen, grass-fed whey isolate, MyHMB, Peak ATP, L-citrulline, Creapure creatine, the only creatine not made in China, vitamin D3, and betaine anhydrous, all in the Fortifeye Fit Pro. Folks, it works. I've got young athletes and I've got old athletes and non-athletes. Everybody taking it. It does help. So try it. But let's talk about this. Now, exercise can help something we talked about just a minute ago. It's called brain-derived neurotrophic factor, BDNF. And this is kind of nurturing the brain cells. And we talked about this on the way in, that maybe we'd talk about this. So talk a little about this BDNF. How do we get it? I mean, are there supplements can help, and what does it actually do?
We did. This was our topic of conversation on our way in here. And this BDNF, brain-derived neurotrophic factor, is so important for our brains, which actually it helps us with the brain cells. It's a natural protein. It keeps them healthy. It encourages the growth of new neurons, which is new brain cells, and it increases our brain cells, the way they can communicate. There's these things called synapses. Those synapses are what get defective in the Alzheimer's. There's that word again. So we want to make sure we keep getting this protein throughout our life, and enhances our memory. But a great way to do it is through activating our muscles. Our muscles are like an endocrine organ. They send messages. They secrete these chemicals. So we know from studies that you activate your muscles through exercise, you're going to naturally release more of this BDNF. Of course, it's not just exercise. You want to do other things, the common sense things. You want to make sure adequate sleep. You want to make sure you decrease that sugar intake and manage stress. Sunlight on your skin, what we just talked about, manufacturing that vitamin D, sunlight on your skin can help with the BDNF as well. But supplements also, supplements that we continually recommend just for the eyes, we find all these other side benefits. Dr. Lange's favorite supplement, that omega-3, that has also been shown to increase this BDNF. So you're helping your dry eye, you're helping your brain as well. And it's just amazing. Oh, one other supplement too that we haven't talked about in a while, that eye pressure and nerve support. That ingredient in there has been shown to increase the BDNF as well. So it's the whole lifestyle and getting those other benefits that you maybe don't even realize you're doing for yourself.
Right. That's a brand new supplement we released earlier this year. It's been a home run. It's called Eye Pressure and Neurocognitive Support. It's a combination of something called mirtogenol, which is pycnogenol, a pine bark extract, and European bilberry, and Numintix. And we're the first to use this in the United States. Numintix is a derivative or a spearmint extract that has some of these benefits. This supplement called Eye Pressure Neurocognitive Support, I developed it for my glaucoma patients and for my patients that are suspicious for glaucoma and have optic nerve issues. We wanted something natural to help support the optic nerve in the brain. And the studies are all on the website at fortifeye.com. Go to Eye Pressure and Neurocognitive Support and look at the science section. You will be impressed. These are double-blind, placebo-controlled, university-backed studies that are proving that this combination of nutrients can improve cognitive functioning, something called working memory. It's a unique complex of over 50 polyphenols. It supports focus during the day without being a stimulant, so it doesn't disrupt your sleep. It aids in neuroprotection of the optic nerve in the brain, specifically the ganglion cells. It increases the neurotransmitter levels and promotes neurogrowth, or this plasticity that we talk about. It supports healthy intraocular pressure. We've seen the studies that it brings intraocular pressure down, sometimes as much as certain glaucoma medications. It works well with other glaucoma medications. It improves blood flow to the eye and the brain, and it reduces accommodative stress. So it's something I take since I race cars. It helps me to improve night vision and reaction time. I want to improve my working memory, but it's something that we can offer our patients that have a potential to develop glaucoma or that have glaucoma. It does not replace their treatment. It's not a treatment. It's not a cure. It's a nutritional support for the eye and the optic nerve. So thanks for bringing that up. We got time maybe real quick for a call. So let's go to Marie in Tampa.
Thank you. Hello, doctor.
Good morning.
Good morning. I have dry macular degeneration.
Right.
I've been taking it for years. AREDS, AREDS,
right,
with number 2.
Sure.
And that's all I've been taking. And I don't know that is sufficient when I'm listening to all the things that people call in about. And
right. Marie, we're running out of time, so we can expand on this next week. But the one I talked about here is called Advanced Retina Formula by Fortifeye Vitamins. You can get it at our Fortifeye Nutrition Center in Clearwater, or you can get it on the website. It's taking the AREDS 2 vitamin to the next level. But I don't have any more time to talk about that, but we'll talk more about that next week. Thanks. Dr. Summerton, you got 5 seconds to tell everybody goodbye.
Thanks for calling. Goodbye. I'm going to go enjoy the beach with my friend Jody here. Have a fantastic day. God bless.
And we're out of here. Have a great day. God bless you and God bless America. See ya.